My name's Marcia, and I'm a clinical nurse specialist at The Ohio State University Wexner Medical Center Richard M. Ross Hart Hospital. As a clinical nurse specialist, I'm involved in quality, research, education, training, bedside instruction. Quite often I become the go-to gal. I get questions and phone calls and pages all day long, which I absolutely love. So that's certainly not a problem to me. Evidence-based practice has always been a part of my practice as a nurse, and certainly as a clinical nurse specialist. I really am able to roll into my role as a clinical nurse specialist. Everything that I learned at the CTEP or Center for Transdisciplinary Evidence-Based Practice immersion course, it really cemented for me what I do as a clinical nurse specialist and how the outcomes and how it can impact my patients and patient care. I think I quite often use that term, well, this is evidence-based, but not really understanding what that meant. And I think as a clinical nurse specialist, it's important for me to be that mentor, to be that role model for other nurses. And what I have found is that by my participation in the immersion course, I've helped generate, if you will, excitement about, hey, you know, that's the way we've always done it, but you know what, maybe that's not what's best for our patients. Our patient outcomes and what impacts our patients has become very, very important to me, even more so than I would have ever thought. An interaction that I've had recently was the opportunity to mentor a staff nurse on 6 Ross at the Ross Hart Hospital, which is a part of the Wexner Medical Center. And she had come to me with a question about falls and how falls might be related to dosage, administration times of diuretics. And we did some lit search on it. So what we found was that it can impact patients and patient falls depending on when they're taking those diuretics. Many of their falls were centered around toileting. What we did was we actually pulled together a multidisciplinary team that included physicians, and we really wanted to make sure that we had a physician champion because this was going to really impact their practice as well as ours from a nursing standpoint. Secondly, we wanted to bring in the pharmacy, because the pharmacists have a great deal to do with our patients and their medications and their dosing times. And so changing that was also going to have a big impact. And then also, of course, the nursing staff and their workflow, their workload. And then the PCAs, or our patient care assistants, you know, how does that impact their workflow and with the toileting and getting these patients up and so forth. What we also found was when we did an informal survey with our patients was that what time they took their usual diuretics at home did not match what we at the hospital said they needed to take them. And so by adjusting it to more of what the patients were doing at home, in addition to what the literature said and the research said that we should be doing, we've matched that and we have changed all of our dosing times so that it is more beneficial to the patient so that they aren't up in the middle of the night needing to go to the bathroom and running the risk of having a fall. So we've actually seen quite a decrease and has affected our fall rate on this particular unit. What's changed in my personal practice since attending the immersion course, I would say has more to do with the fact that I can really speak to what literature says and really be very confident in saying that this is what the research says that we should be doing and these are the reasons why that we should be doing it. And so being able to speak to that more confidently, I think has had a very large impact on helping change practice and helping change things so that we can impact patient outcomes, patient care. And what we're also finding is that more and more nurses at the bedside are getting excited about it as well. I think when you have someone who is a mentor that is excited about something, it's easier to get excited about something as well. And so I think that's another large role that I play, is to help get nurses energized. I've been a nurse for over 40 years. To see nurses get really excited again can impact and improve patient outcomes and patient care. And it's never about me, it's not about you, it's not about anybody else, it's about our patients and what's best for our patients. What I would really like others to take away from my experience, I guess, it is a lot of work. However, the end result or the outcomes are unmatched. You can't even measure the satisfaction that an individual can get from going to this. I know that when I came up with my first PICO question, which had to do with pressure ulcers in the cardiovascular patient population, I thought I had a pretty good handle on what it was, what I needed to do, but it wasn't until I really and truly looked at the evidence out there and said, you know what? We need to change this. This is what we need to be doing. And I have to tell you from our own experience, we've seen pressure ulcers in our cardiovascular patient population go from 23% down to 0. You can't beat that. To be able to realize that one person can make a difference when it comes to patient care. And by taking that and getting it to the bedside, and I think that's the key, is that we've got to get this research to the bedside. And so I think that this whole movement of evidence-based practice has just been absolutely so rewarding, and is something that I never in a million years dreamed that I would come out of so excited, so energized, and oh my gosh, we got to get this done, and we got to get it done now.